This is Pukeology Podcast, where science meets your hilarious puke stories and the tips and tricks to stop that up-chuckle that you need.
You never know what's going to spew out of her mouth. Here's
my mama,
Dr. PukeNoMo.
Welcome to Pukeology Podcast, Episode 2. What is morning sickness like? Want no more morning sickness or pregnancy nausea? Visit our sponsor, nomonausea.com, the only natural way to instantly stop your pregnancy nausea and vomiting now. Or just place your Nomo Nausea band on your baby's registry for your delivery bag at selected Bye Bye Babies. Pregnancy humor is that which makes you or could potentially make you pee your pants. Like you don't have to pee all the time anyway. With crazy stories that I'm about to tell you, like chicken coop to chicken puke, the scent of the city, and fainting goat. If you want to learn more about your pregnancy, humor, or knowledge, it's important to key in to help you survive these next 9 months. And just know that we're in this together. I myself have been pregnant with my 2 beautiful babies, so I'm here to help and all of the medical knowledge that I can give to you. So what are the 3 things that I think that you can take away from this episode? Number 1, what is morning sickness like? And what are the presumptive signs of pregnancy? What are the things that make you think, I might be pregnant even if I'm not nauseous every morning? The second is the causes of morning sickness, the sights, the smells. What actually makes morning sickness stir in that pot or make that stomach upset? And then lastly, the misnomer that nausea happens in the morning. I hate that they call it morning sickness when in reality, it can be all day morning sickness.
Throwing up on a Tuesday? One puke story.
I spent 20 weeks with my head in the toilet, throwing up at least 4 to 5 times per day. Vomit was always in the back of my throat, and I couldn't swallow it back down. Gross. Anytime I heard the word chicken, saw chicken, or smelled chicken, I would be sick. As a teacher, I would have to make up excuses to leave my room all the time. Never mind the fact that my children were alone by themselves as I'm worshiping the porcelain god with my head in the stomach. I could be in mid-conversation and just run to throw up. Unfortunately, one time, I was talking to my student and bent over his desk. He got completely showered with my breakfast. He asked to be moved to the back of the classroom while I was pregnant. Thanks, Marissa. She's 29 and a mother of 1 for chiming in on your hilarious chicken coop to chicken poop stories. Nausea came on very suddenly. Sometimes I would feel better right after vomiting, but other times I just felt nauseous and couldn't get it to go away. This was the summer that I smelled the city. The city smelled extra disgusting, and I couldn't get this scent off of me. Plus, gasoline pumps, forget about it. I wasn't able to pump my gas for 9 months. I spent all the time avoiding them, or I would call friends down from their apartments to come help me pump gas, take them right back so that I wouldn't actually have to be at the pump and smell it. The last time that I tried to do it myself, I started vomiting all over the second hand of the lever. A nice homeless man helped me to finish pumping my gas for me as he felt bad since I couldn't stop puking at the gas station. Thanks, Rachel. She's 30 years old and currently 23 weeks pregnant. So good luck with everything with that baby. The nausea would start when I woke up and lasted until bedtime, with worst of it at night. I only threw up a handful of times in the entire pregnancy, but I was surprised at how horrible it can be to be nauseous all day, and day after that. Even if you aren't throwing up, I didn't realize that nausea could make you faint. Hence, my friends used to call me the fainting goat. Once I fainted while standing in a crowded subway, and another time at a farmer's market. I was so nauseous that all of a sudden, without any idea, boom, that's it, I'm out. I cannot imagine being pregnant ever again. Jordana, who's 32 and a mother of one.
The Science of Puke, Pukeology.
So what is morning sickness like? I think that's pretty much the topic of discussion here. But what's really interesting, and what I believe you guys can get out of this the most, is, have you been pregnant and not felt sick? I got that beautiful opportunity actually one time with my handsome boy. When I was pregnant with him, I had no problems. I wasn't sick at all, and it's probably because I was running around in my job in the operating room, so I felt like I didn't have the ability or the time to. But that doesn't mean that I didn't feel the signs and symptoms of starting to get sick. So what's interesting is that morning sickness is associated with nausea and vomiting and is known presumptively as the sign of pregnancy. New studies link that morning sickness, or the sensation of that, are signs of a healthy pregnancy. They do link it to morning sickness lowering the risk of miscarriages, but again, that is just presumptive, meaning that the people who are having miscarriages may not suffer with as great of a degree as nausea and vomiting, since nausea and vomiting and morning sickness itself is actually brought on because of hormones. So when the hormonal changes are not changing as great, because unfortunately the fetus has passed, that's when you might not get that morning sickness, I should say. But now the new studies have actually shown that they're linking this morning sickness to signs of healthy pregnancy, but that doesn't mean that you have to puke for your 9 months. You can mitigate the signs and symptoms, but still know that your baby is growing effectively. Still, 20 to 23% of women don't have morning sickness and still deliver healthy babies, just like I talked about mine. You could feel nauseated early in the morning, followed by vomiting itself. Or you can just have nausea, like one of our hilarious listeners, Jordana, who she just would faint because she was so nauseous. So what does that nausea actually feel like? Okay, so how many of us have ever thrown a couple back in college? That feeling of hungoverness is brought on because of dehydration. Dehydration actually ends up pulling the meninges, which means the connection of the brain, and pulls it down because it's not full anymore. That gives you the headache. But the nausea, the upset stomach, is because of the fact that your body has literally exhausted all of its nutrients, and now you have this pit of alcohol that is fermenting in your stomach. Think of that fermentation feeling as what you feel in morning sickness. Now remember, some people don't ever have it go away. Most people end up feeling nauseated, and I say about 80 to 88% of women experience morning sickness during their pregnancy at some point in time. Some followed by vomiting, but others not. Again, when you feel this nausea early in the morning, sometimes helping it in the evening can actually help to make sure that you better yourself for the very next day. So if you want to learn more about what morning sickness, like when does it start, you should check out our episode 1 Pukeology Pregnancy Podcast called When Does Morning Sickness Start? Now, the causes of morning sickness, smells and tastes are the primary. Perceived and heightened sense of smell is when a woman gags at certain odors. I myself, for me, it was the smell of BO, number one. And number two, I was very sick by gasoline, just like one of our other listeners, and that was Miss Rachel. So again, I felt compelled, like it was bad for my body. Other people will actually crave the scents and smells of things that they are lacking. So if they are, let's say, vegetarian, normally during their lives, they smell meat and the meat smells good. It means that they could potentially be anemic and that your body is trying to treat whatever it's lacking. According to the International Journal of Obstetrics and Gynecology, pregnant women have olfactory, which means smell, processes that are different from non-pregnant women. 40% of the chemical senses in cooking odors, cigarette smoke, spoiled foods, and perfumes are processed differently. People find those 5 items to be very offensive, especially during pregnancy. Foods also have been linked that pregnant women do not like, such as beans, spaghetti sauce, fish, eggs, and 14% of these women have what's called phantom odor. It resembles feces, and they can't get it out of their nose. Literally, the entire time that they're smelling all day, every day smells like poop. Now, if that doesn't make you want to puke, I don't know what else will. Now, coping with the avoidance of these super strong odors can be helped by eating something salty. They say that eating smaller meals more frequently is better than 3 big, large meals, and most heightened sense of smell actually resolves usually by the second trimester, just in time for second trimester headaches. Isn't it wonderful being pregnant? If you can feel my sarcasm exuding from my voice. And our third is, let's explore the term. Morning sickness is what we talk about, a misnomer, that people can actually experience this vomiting any time of the day, all day, every day, and some that have severe sickness and pregnancy called hyperemesis gravidarum, unfortunately do have to be hospitalized because of this. If you want more information, once again, check out episode 1. It's our Pukeology podcast for pregnancy called When Does Morning Sickness Start? And we start to talk about hyperemesis gravidarum. Did you know that less than 2% of women with morning sickness had nausea and vomiting only in the morning, which means the 98% of these women are getting sick all day, every day, which again, these waves of nausea. So they kind of come in as a cyclical pattern. Some people will feel them like a big gust in the morning. For me, it was at morning and at nighttime. I felt like whenever I was really hungry, it would actually help to mitigate my feelings and or sensations of being super sick because of the fact that I knew that I was going to get full. So if I just would make sure that I would eat something small, snack throughout the day, I would actually be less sick. And remember, because of the fact that women their stomach itself is being pushed by this lovely baby, as well as their bladder is filling up a lot more, pregnant women also have an increased chance of getting acid reflux. That's why some of us live on Tums next to our bedstands and saltine crackers. But again, the cramps, the nausea, and heartburn are also something that you may be experiencing with morning sickness. A lot of us women have never been through pregnancy, and I get it. I know from both sides of the fence, so it's hard to be empathetic, especially if you don't know exactly what morning sickness is like.
Tips and tricks to stop the up-chuckle that you need.
Natural is always best. Foods like ginger, lemons, or the pectin of apples have actually been shown useful. But the last thing that I want to do is put anything into my mouth, because food increases, even water, believe it or not, increases the amount of stomach acids. Now, a lot of times people are getting nauseous because they are dehydrated. So women, it's very important to carry a nice canteen or a water bottle or something cute and stylish for your pregnancy. Keep it on you at all times, clip it to your bag, whatever that may be. But I'm just letting you know that anytime you send anything down your mouth, it signals your stomach, hey, let's increase the amount of stomach acids we are producing because we're expecting to get food. Women during pregnancy have an increase in acid reflux, like I had stated before. Hence, the Tums, right? Well, Tums are only going to work as an antacid, which means it's only going to lower the acid that's currently there in your stomach. So I don't recommend popping them because what happens is your body is a nice balance. If you produce more stomach acids and you keep like pumping in the Tums, keep pumping in the base, then guess what your body's going to do? It's going to increase even more acids to combat against that. So you're really just revving up your acidic engine. Instead, ladies, try acupressure on the wrist at P6. The P6 point is located 3-finger distance from the first wrist crease in between the first 2 tendons. And at that point, you actually help to increase the amount of hormones. And I call them anti-nausea hormones, but they're also called beta endorphins. These endorphins, or also known as anti-nausea hormones, will actually coat the receptors to help you not get sick before you start feeling ill in the morning, or for the rest of us pregnant women, feel sick throughout the day. So you can actually help you to not feel sick just by applying pressure at 5-minute intervals. But let's be frank, if you have another baby, who has time to press on your wrist for 5-minute intervals? And you have to do it at least for 15 minutes at a time in order to start getting the effects 45 minutes later. This is the reason I highly recommend peppermint essential oil. So peppermint essential oil is amazing because of the fact that it has this cooling sensation upon the skin. Hence, NoMo nausea band is actually the combination of peppermint essential oil and acupressure. The peppermint essential oil makes you forget that you're sick in the first place because of the cooling sensation. It's a distraction technology. Also, peppermint is actually absorbed through the skin, and it is considered a smooth channel blocking mechanism on the calcium receptors. Big terms for it relaxes the stomach. It helps it beat in synchrony to push down food. As you push down food, guess what? Nothing is going to come up with vomiting. So that's the reason why medications like Reglan are also increasing the amount of food being pushed down, but it does come with some horrible side effects like decreasing the amount of dopamine that you have in your body, and dopamine makes you happy, so you don't want to take any type of medication like that. Zofran, which is the most commonly prescribed morning sickness medication, has been linked to birth defects, heart problems in children of mothers who have been medicated during their pregnancy. I had a beautiful boy who had a heart murmur, and it was because I used to take Zofran, popping it like candy. Highly unrecommended, and a lot of OBGYNs will actually state for you to try natural mechanisms. Many OBGYNs across the country will suggest NoMo nausea bands because it's a great first-line defense. Why put fake, false chemicals in your body when we don't even know the side effects and what can actually happen? So I want you guys to really start thinking more natural, especially because it's not just you in your life, it's the life of your unborn child, and they have a very immature liver at this point as well. Peppermint essential oil, when smelled, believe it or not, like aromatherapy, actually helps to stop vomiting immediately. The fastest way to your brain is through your nose. Each of the 3 techniques that I talked about, the distraction technology of the peppermint essential oil, the acupressure at P6 point, and the aromatherapy of helping decrease nausea and vomiting, can all be found as a combination inside the NoMo nausea band. And it's made it easier, more stylish because it is sexy upon the wrist, and it's a waterproof wristband that's clinically proven by multiple clinical trials to stop 80% of your worst pregnancy upset stomachs. You can find NoMo nausea at nomonausea.com. That's NoMonausea.com. Or you can grab us on Amazon, Zulily sometimes when we're running sales, and now new to it at selected Harmon locations of Bed Bath & Beyond and selected Harmon locations of Bye Bye Baby. Coming this summer, you can find us at 5,000 CVS stores, so make sure that you go pick one up today. Thank you guys again. My name is Dr. PukeNoMo, and I have had an amazing time with you guys explaining what does morning sickness actually feel like. Well, now that you guys know, you have been highly entertained with a lot of humor, and you'll never look at chicken the exact same way after our chicken coop, chicken puke story, as well as you understand why morning sickness happens and what can you do to actually help to fix it. Join us next month for another pregnancy edition of Pukeology.
Pukeology Podcast, edutainment at its finest.